Thank
Well,
you.
good morning.
Hi, Paula. I was going to introduce you.
Thank you.
And say some things about you to the group. We very much appreciate your being here. We're being joined this morning by Dr. Paula Otero from the Hospital Italiano in Buenos Aires, Argentina. She was co-chair of the MedInfo Scientific Program Committee in 2021, and in 2023, she is the president-elect of the International Medical Informatics Association. Paula is a longtime friend and colleague and a brilliant informatician who has been one of the leaders of the wonderful work that has been done for many years in Argentina, and really that work stands as a beacon for the rest of the world and what can be possible by executing some of the principles that Alan Lebrecht was talking about today. So Paula, we have a technology implementation here. It's all about technology implementation. And it turns out that the questions that are being posted will be visible to me, and I will pass them along to you.
All right.
The original plan was for Alan and Paula to be present for the Q&A session this morning, but unfortunately, Alan could not be present. So, Paula, you are going to be the person who will be addressing questions that have been directed at Alan, and in some cases more generally, but you are more than up to the task, I'm sure. So I know you might have prepared some comments that you would like to offer to us before we get into the Q&A session. So why don't we entertain those at this time?
All right. Well, thank you, Chuck, for your invitation to be part of the MCBK event. That is really interesting, and it gives us the opportunity to get involved in all the activities. And also, I really enjoyed Alain's talk. Smart guidelines are not new to most of us. We were expecting WHO to take charge of, getting guidelines in action and make it available for everyone. What I can see from Alain's talk is the chance that no matter how mature your health information system might be, you can use those smart guidelines. And I guess that is the key point of them being implemented. Another key issue is the chance not only to include providers, but also work on patient empowerment, give the health information of each person on their handheld device so they can travel across borders and have all this healthcare information. So I think that the role that WHO is carrying out is really good for all the regions. This is a worldwide event, and I would like to focus mainly on the current situation in Latin America. Latin America has a whole more than 27 countries that form part of PAHO, and those countries have different level of maturity in health information systems. So I think that from our point of view, the smart guidelines could help in not only improve healthcare delivery, because it could enhance and, start doing what is right for patients. And in order, since they are going to be digitized, it's going to be really easy to follow. On another hand, it can be a great support for health workers, especially in rural areas where they can, have healthcare processes that are based on international recommendations. And that is really good in order to provide the healthcare that people need. Like I said before, the chance of empowering individuals right now, everyone has some kind of handheld device, and the limit of communications is no longer a great burden. Right now, we need specialized people that can work on this development and also work on the adaptation of these guidelines to the regional, national, and local level. Also, all the work that has been done regarding the SMART guidelines and how they have been adopted to FHIR, most of the Ministry of Health and of the different countries in the region have adopted HL7 standards and FHIR as a way to improve. So if we can provide to this starting health information system from different countries in the region, it might help to already, not to reinvent the wheel, since everything is just, not plug and play, but most of it, so you can adapt those guidelines to your local setting. And also the chance to have a global health data exchange. We all speak about interoperability and health data exchange, but that is not really happening. So I guess that the chance to start using the SMART guidelines in that chance would be really great. In summary, I celebrate the work that the WHO is doing on SMART guidelines, and it's, of course, a way of mobilizing computable knowledge, medical computable knowledge, and it can help to build a framework in the region and all around the world, of course, so the healthcare systems can improve processes, and also through collaboration, not only north to south, but also south to south collaboration with the help of WHO. So I think that if all the countries can start working on adopting these kind of guidelines, we can move forward in more efficient, patient-centered, and data-driven healthcare systems that can be of benefit for all of us. So I really enjoy Alain's talk. So based on that, I would like to know what do you think about all these SMART guidelines, if you have some experience, and what is your point of view regarding this initiative from WHO?
Thank you, Paula. We have some questions that I'm appearing before me here, and I hope that as the session unfolds, more will appear, and I will relay these to you. I'm also going to take some liberty with the phrasing, because they were phrased on the assumption that Alan would be here with you, but I'll affect the grammar, so they are modified appropriately. So, Paula, how do you think that the SMART guidelines will address the central challenge of human cognitive limitations of clinicians, their unwarranted clinical decision variation, and their common failure to follow guidelines? I know this is something you personally have been thinking about for quite a while.
Yes, I guess that anyone who has been working on health information systems has come across that kind of a burden or problem. Usually, we don't like to follow guidelines, and we resist those guidelines. So I guess that the best thing to follow those guidelines is to first try to adapt them to your local environment. So we are all looking forward to provide better health care, but sometimes we don't have all the resources. So maybe a guideline should be properly adapted to the context of the country or the region you're working on. And I agree that the guidelines sometimes are made for first world countries or developed economies, and sometimes you cannot work on that. So I guess it's the Ministry of Health of each country, of each region, to work on that and involve key leaders of healthcare implementation, of health information systems implementation, so that we can get everyone on board. Because when all the end users, the healthcare providers, or even the patients, they see a benefit from the system, they will use it. So I guess that the key component is the word smart. They have to be smart in order to address all the needs and all the context. So I guess that is something that has to be worked on. And WHO is the best organization to do that, because they work mainly on addressing all the needs from the different countries, of all the member states.
Thank you, Paula. The next question addresses a point that I think you've already addressed in your opening remarks, but we'll give you an opportunity to go a little bit deeper. This question goes to a concern that digital health will actually widen the gaps between different levels of society. How do you think the WHO SMART effort could address this problem?
Well, I guess that the SMART guidelines effort aims to diminish or no longer have that kind of gap. And again, WHO works for the member states. So the member states have to know really good what are the current situation. For example, I would say in my country, in Argentina, the Ministry of Health has been working with all the different provinces. I have everyone sitting on the table discussing what are the guidelines. The healthcare system in Argentina, it's a federal system, very much like in the US, where the Ministry of Health, the National Ministry of Health, proposes and gives the resources from some initiatives, but also local initiatives can work. And not every country, not every region is the same. But I guess that the path of the SMART guidelines and the way that you can adapt them and the easy they are to implement, then you don't need any kind of, special development, and you have to develop on your own. Is everything given to you. That has been shown that in other countries it works. So I guess it might work also for the Latin America region.
Thank you, Paula, very much. So the next comment begins with an agreement that much work is needed to help capture data and workflows, including in the UK, from where this question originates. And it seems that SMART will greatly improve this. How will SMART, in your opinion, help disseminate knowledge from WHO clinical guidelines to improve clinical decisions?
Well, I'm not sure if I can answer that, and that is a question that we might give to Alain. But I guess that the chance of having information, because if the guidelines are going to be working on some kind of information you have on your health information system, and just giving information to the system and not having all disseminated outside the system is going to be a great step. So the only chance of having a proper identification of your population, having the chance to define what are your healthcare needs based on the epidemiology statistics. So I guess that at the beginning, we might have to, in order the SMART guidelines to work, to provide some data and information. Based on that, the SMART guidelines can be the first step to start, building knowledge and wisdom in order to provide better healthcare system for each country. We have seen this example regarding vaccinations that Alain shared with us. And I guess that it would be a great start point to work on vaccinations in every country, not only for COVID, but for all the other diseases that there are vaccines for. And you can see in one of the slides, there's a lot of SMART guidelines that are going to address primary activities or primary care guidelines for pregnancy, for infants, for children. So I guess that little by little we can address the big topics in healthcare and then move to the other ones. But we have to start in some point. So I guess that the chance of the SMART guidelines giving you this kind of open opportunities, we have to use them, because it's not like WHO is trying to implement something new, completely different for what is going on around the world. The world is speaking about fire, and everything, all the systems we finally agreed to work on fire. So I guess that is the great initiative that WHO did with the SMART guidelines. They're not trying to impose some kind of system. They're going to use, we have this information, you can make it work on your system. And if you don't have a system, you can also make it work based on paper, because we also have, I guess that they cover all the possibilities.
So the next question, Paula, goes to a transcendent issue with all clinical decision support that is driven by knowledge-based systems. Medical knowledge changes over time. How can this system include corrections for changing knowledge, including unlearning things that have been outdated and shown to be biased or misleading? And this person points out this applies in a very, very broad set of contexts. And you might want to speak from your experience in Argentina, because I know you have many systems of this type deployed.
Yes, I guess that we humans tend to believe what the system says, and right now with AI is working like that. If AI recommends something, we usually follow it. So I guess that the chance of these SMART guidelines being coordinated by WHO, they might, because Alain in his talk, he said that they were going to be adapted and updated. So what we have to give it a chance in order to mature, because no system can work if it cannot adapt and change based on the current situations. We were none of us was ready for COVID, but we have learned a lot from that. So we know that we have quickly change and adapt, but change and adapt with our both feet on the ground. We cannot make these changes just because some paper or someone said something. We have to respect that the knowledge and it needs to grow in order to make these changes. So if we decided to follow the SMART guidelines, we as part of the SMART Guidelines project, because WHO finally works for all the member states, we can propose changes, and these changes have to be evaluated in order to see if they work everywhere.
Thank you. Our time for this session is running us toward the close, so we have time for just a couple of more questions, and I'm going to select some that I think are most pertinent to the larger purpose and strategy behind the SMART program. There are some other questions that go to technical implementation details of SMART, which we will pose to Alan and his team and probably post them on the MCBK website. There are some excellent questions here. As talented as you are not omniscient, Paula. So we will leave those questions to Alan and his team. But here's one that's very broad in its implications, and this comes from the Netherlands. Medical training here is very focused on guideline adherence, and there is a strong adoption of evidence-based care within our care delivery network. Are new education approaches needed for SMART guidelines to work in practice?
Well, I guess that, I don't know if it's going to be as strong, but the thing that you work on guidelines, we have to decide if SMART guidelines is the ones that we're going to adopt. Because I guess that maybe the guidelines that they're working on in the Netherlands can be of help for other countries. So we don't know if I trust that what they're doing in the Netherlands is really good. But if we want to embark on a worldwide project, maybe the Netherlands don't need to adapt all the guidelines and just pick up those that they're not working on. Based on what I said, that they should, my idea is that they should be curated and adapted. I don't think that the guidelines from the Netherlands are going to be very different from the ones WHO is proposing. So I believe that won't be a problem. I believe the SMART guidelines are going to based on what I talked in previous meetings with Alain, they're going to try to get everyone on board and learn from what is already done. And that experience, share it with those that have not even work on a guideline before.
So that's great and a terrific response. And with just a few minutes left, I want to stay on this question because it's so important and come at it from a slightly different direction. In the Netherlands, there is this strong, almost a tradition of evidence-based guidelines being implemented in care. Let's go to another nation where that tradition doesn't exist. How would the educational process of clinicians, both future clinicians in training and practicing clinicians working in the field, have to change in order for this guideline-based work to be accepted? I wanted to give you a good challenge here as we bring this to a close.
Yeah, it's a really great challenge because different countries have different, training programs. Some are problem-based, some are evidence-based, and this is in continuous change. But I believe that no matter what kind of training at the universities you might have, in the end, we always try to do what is best for the patient. And in a maybe bigger or smaller way, we always are working on some kind of guideline. Maybe it's not the best guideline, maybe it's a guideline that is adopted to the national levels, but I guess that we have to rely on what the Ministry of Health is proposing and try to adapt the educational programs so that we can start thinking in a orderly mannered way to work in processes, because finally is doing things in certain order so that you can use the scarce resources that right now we're having in healthcare all worldwide, using it wisely and trying to provide what is best for the patient. So I guess that no matter where you are or no matter what your training is, we are all working on guidelines. I guess that the greatest challenge is that we all try to jump on this proposal from SMART guidelines from WHO and try to make it work or adapt it locally if it's possible.
Okay, thank you, Paula, very much. We're indebted to you for bringing all of your experience and knowledge to bear, human knowledge, not computable knowledge, on this important topic, and we're very indebted to Alan for his excellent presentation.